There's 4 types of questions for the majority of questions on your BCEN, and those will be assessment-based questions, intervention-based questions, evaluation-based questions, and analysis-based questions. Now, the percentage of each of those is established in the blueprint of the exam. So if you go to the BCEN website, you'll find the blueprint for all their exams, the CEN, the TCRN, the CPIN, and so on. And they'll tell you what percentage of each of these questions there is. 26% of this and 21% of that. So you can kind of figure out how many of each of these types of questions you can anticipate as you study. And then for your professional issues questions that are not disease related, but they're patient care related, the classifications of questions are either cognitive, application, or analysis. And again, the percentage of each of those would be listed on the blueprint of the exam. One way you can use this to help your studying is when you do practice exams, they should tell you which type of question is it. Is it evaluation-based? Is it assessment-based? And so on. And you should learn which areas you're weakest in. If you find that you do the poorest on assessment-based questions, then as you study signs and symptoms and how to assess patients. If, however, you do poorly on intervention-based questions, then you should be focusing your studies on how we care for patients with these diseases. So you can use this information to guide your studying. I hope you found this information helpful, and I have a whole bunch of other modules available on ways to prepare for a certification exam. Make sure to watch them all, and good luck on your studying.